there's a saying that's been around for a long time, and that's standing on the shoulders of giants. So it's a notion that in order to better yourself, in order to learn or advance knowledge, don't start from scratch. Learn from someone who already has that good knowledge base so that you can grow, so that you can see even further than they were able to see. So that's the approach that I take to mentoring, right? Like we discussed earlier, I felt very siloed. I don't want to necessarily say alone, but I had to scrimp and scrounge and dig for all of the information that I could find learning about substance use in the early days. In the beginning, when I was trying to get that knowledge, I was very self-motivated in trying to get all of that on my own.
I tried to really connect with experts and find out how they ran their outpatient program, how it worked, what was working for them, what didn't work as well, and I tried to learn from that. And so by the time that we opened our first outpatient clinic to provide the MOUD with buprenorphine, we were feeling confident that we were ready and ready to meet people's needs at that point.
You don't have to do this alone, so you can get consultation, you can get help.
Start screening. An initial first step, even before they are interested in prescribing buprenorphine for opioid use disorder.
Well, we're going to start this patient and see how they do. And, usually after seeing that patient, they are, really impressed with their progress and are pretty quickly on board.
So I feel like it's our job as a peer to be their advocate. And I'm not saying go out and do all the work for them, but just go out in your community and build those connections so that you can share them with your client and make a plan.
Don't let perfect be the enemy of good. Just because I don't have the ability to offer counseling in my office or getting someone to a psychiatrist that needs psychiatry or access to a treatment center or all these resources that they think they need, and those are very important. But if you can individually also offer one of the tools they need, and if that tool in your primary care practice is offering the buprenorphine treatment in the appropriate setting for the appropriate patient, then that's something you can do.
But I think the thing to remember is it's a marathon, not a sprint. You don't have to cure everybody overnight. In fact, that's going to be by far the exception, not the rule. This is a slow train. Take your little wins, keep going.
Do it for you, not for your organization. Do it because it's going to make you feel good. It's going to make you have a purpose to rekindle that fire of why you got into medicine to begin with, which is to help people for most folks. So start incorporating treating substance use. You'll never turn back.
Yes, there will be patients who will not be adherent, who will not be enthusiastic, who will not say please and thank you. I get that. But most of the patients will respond in a remarkable way, and it's so gratifying to be able to see them get better from the depths of the lows that they've been in to restoring their functional trajectory and get back into life, if you will.